This is a muscle energy technique to improve hip extension and knee flexion. Start this technique by reaching one hand underneath the medial aspect of the patient's anterior thigh. Passively extend the hip and stabilize their pelvis with the other arm. This will stop the pelvis from rolling when you move the hip into extension. Passively extend the hip to the first point of resistance or tissue bind. Cue your patient to perform a gentle isometric contraction into hip flexion. This should be held for approximately 7 to 10 seconds. Upon relaxation, increase the hip extension range of movement to the next point of tissue bind. To assist with this technique in larger degrees of hip extension, place your knee on the table to support your patient's thigh. Ask the patient to repeat the isometric contraction into hip flexion. Once again, upon relaxation, progressively increase the amount of hip extension range of movement. This process can be repeated for approximately 3 to 5 repetitions. The next step is to passively flex the patient's knee while their hip is in extension. Once you reach tissue bind, cue the patient to extend their knee by pressing their ankle into your hand. Upon relaxation, passively increase the amount of knee flexion range of movement, and then repeat the isometric contraction. These isometric contractions should be gentle at approximately 20% of the patient's maximal force, and they should be held for between 7 to 10 seconds. These can be repeated over about 3 to 5 repetitions.